warm welcome to our session today. I'm Joyce Matthew Kurian, and welcome to our webinar on positive aging. What is positive aging? Positive aging is a state of mind that is positive, optimistic, courageous, and is able to adapt and cope in flexible ways with life's changes. It is possible for us to maintain purpose and meaning in our lives, even if you're faced with significant disease, disability, impairment of mental and physical functioning, limited participation in other activities. Let us hear how we could do that. Before we move on to the discussion of the main topic, I would like to give you a brief on Vaya Vikas. Vaya Vikas is a registered trust with a dream to build and strengthen an ecosystem for our seniors that empowers the seniors to lead a productive and meaningful life. We are a community of senior citizen members enabled through an online platform with focus on a wide range of services, starting with legal, financial, health, wellness, and engagement. Before we move on to our session, I would like to advise each one of you how you could actually participate in our session today. It will be a 30-minute session followed by a question and answer session. You would have an opportunity to submit questions to our presenters by putting your questions in the chat window. You may please put in questions anytime during the presentation. We will collate all of them and get them answered towards the end of the session. I request each one of you to kindly mute your devices once we start our session. Let me also remind you that towards the end of the session, we would also have a feedback link which would be shared in the chat box. You could kindly click on the link and leave your valuable feedback, which will help us to make these sessions much more interesting and better. Without any further delay, I would like to introduce our speakers for the day. We have Dr. Rekha Gande and Professor P.T. Shivkumar. To start off with, I would like to introduce Dr. Rekha. She is a consulting gastroenterologist and is currently the dean and one of the directors of Sishrusha Citizens Cooperative Hospital, Mumbai. She is also the president of Welfare Association Agency, Mumbai, president of Dilasa Group of Senior Citizens, Dadar, and the vice president of the Federation of Senior Citizens of Mumbai. Her areas of interest are public health and health advocacy. Her publications are Gastric Mucormycosis, Indian Journal of Gastroenterology. She has also been awarded the Y.B. Chauhan Pratishthan Award. Welcome, Dr. Rekha. We also have with us Professor P.T. Shivkumar, the Professor of Psychiatry, Head of Geriatric Psychiatry Unit, Department of Psychiatry, National Institute of Mental Health and Neuroscience, NIMHANS, Bangalore. He is the Nodal Officer for Biomanasa Sanjeevani, an outreach initiative of NIMHANS to promote healthy aging. He is also the Nodal Officer of Biomanasa Seva, National Initiative for Skill Training on Dementia and Mental Health for Caregivers of Older Persons, supported by the NSC Foundation. He is also part of the Karnataka Resource Center for Senior Citizens, Government of Karnataka, and the Legal Services Clinic for Senior Citizens, NIMHANS, in collaboration with the Karnataka State Legal Service Authority. He is also the Vice President of Alzheimer's and Related Disorders Society of India and the Joint Secretary of Indian Association of Geriatric Mental Health. His areas of interest are geriatric depression, Alzheimer's, dementia, and healthy aging. He has a total of 104 peer-reviewed publications in his name. He has played a very promising role in the recognition of geriatric clinic and services NIMHANS for the following awards: Vayoshreshta Samman Award under the category of Best Institution for Aging Related Research, awarded by the Ministry of Social Justice and Empowerment, Government of India in the year 2016. Also, the Government of Karnataka has awarded NIMANS the Best Institute for Services for Senior Citizens in the year 2017. We thank Dr. Rekha and Professor Kumar for accepting our request and being part of this webinar. Over to you, Dr. Rekha, to take us forward.
Wonderful. And welcome everyone. And we're really happy to see so many of you have joined us on this platform. Dr. Sivakumar is an expert in today's topic. And the first question I would like to ask him is, sir, they say that positive aging promotes health. Is that true?
Thanks, Dr. Rekha, and thanks for the kind introduction, Joyce. Good evening, everybody. Happy to join this forum of Vaya Vikas in interacting with you all today. And the topic of positive aging is something very, very important in the context where when we think of aging, how is it often depicted? Many times, what is depicted is a frail elderly with a walking stick, somebody who is sick, and the image that comes is somebody who needs kind of assistance. But what is kind of well known, actually, if you look at closely in the literature, is that aging is a much more heterogeneous kind of entity, and not all people age at the same way. There may be a person with a 90-year-old who is running a marathon. There may be a 40-year-old person who is bedridden because of various health issues and crippled and who's not able to take care of himself. So age is just a number, and aging is associated with frailty. If you look at the number of people who have frailty, maybe more in aging, but I think positive aging is still something which is very much possible. And I think that is one thing which has been shown in a lot of research, that people who are active, people who are positive in mindset, and people who are having resilience, they are able to overcome the same level of stress compared to somebody who is not been able to cope. So I think the personality of the individual, and this is something not something which is which remains static. The coping abilities or positive coping strategies is something which can be learned at any age. So there are evidences for that, where people have looked at long-term studies. There are centenarian studies how people have followed up. There are many aging studies across the globe, and these things have been demonstrated without any doubt. And I think, Rekha, I think you as a person who is very well connected with senior citizens, I think you would be very much aware, and you are an example of kind of leading so many organizations and serving the society at whatever age. And I think we have so many examples like that. And all of you people who are many senior citizens who are participating today are themselves are taking some step to kind of remain connected and remain positive about many things. So I think there is something like which we need to kind of discuss further and take it forward in every aspect.
Sure, sir. In fact, this every aspect, in 1948, the World Health Organization had declared that health is not just an absence of disease or disability, but also a state of physical, mental, emotional, social, and financial well-being. And I know, sir, you have done so much work in the psycho and emotional and social. You've done work in the behavior that you're seeing, and that you would like, and you have been instrumental in changing people's outlook, because a happier person is always a healthier person. So, sir, I would love you to give us some examples of this sort of positive thinking and, things like that. I mean, please go ahead. I mean, we'd love to hear you as your experiences. How would our viewers, our audience, how would they be impacted by your experience? Please go ahead, sir.
Thanks, Dr. Rekha. So, if I have to kind of share some of the experiences, I think what people have to understand is that I sit in a place where people come with the most severe psychiatric illnesses. We are sitting in a tertiary care centers, okay? So, which is actually the one end of the spectrum. If you look at mental health, it is a continuum. People who have, as health kind of mental health is something integral part of health, and as health, which is a continuum, mental health is also a continuum where people can have ups and downs, people can have normal variations in their emotions, anger, whether it is sadness or whether it is say anxiety. Everything can be part of your normal kind of day-to-day activities also. But the same thing, when it happens in a much more severe manner, people come to us seeking help. And even in those people where we treat people who get medications or counseling or psychotherapy interventions, if you look at what determines the outcome, it is not just medications. It is about how they cope, how they're able to accept what is the problem, and how they're able to kind of look at solutions. So there is good evidence that psychological interventions and self-help interventions help even in people with diagnosable mental illness or in the severe end of the spectrum. So it is something which is basically required for everybody. You need to have a good lifestyle, which includes sleep, your kind of physical exercise, engaging in a cognitively stimulating activities, social engagement, and managing your stress. I think day-to-day stress, whether it is about physical health, whether it is about any other say something like a loss, where people in elderly age group, you may hear something which is more traumatic, whether it's somebody losing your close friend or family member, or which is a very traumatizing kind of a stress which can have, and a lot of financial and ongoing chronic stressors can be there. In all these things, people who are coping up, people who are having a positive attitude, trying to find solutions, they do very well. So I as a clinician, I can recollect many such experiences where a patient who has come with a very severe mental illness has a kind of recovered, and it is often an effort of the individual as well as the family members and caregivers of their supports. And sorry, so that all those things leads to kind of help. So the most severe kind of mental health issue what we talk about is dementia. And even in person with dementia, there are patients who kind of maintain their activities with the support of the family members and who are able to still have a meaningful quality of life. You can see globally, if you see, there are advocates of persons with dementia. Somebody who is having in the very, very initial stage of dementia, there are people who come out and say, I have dementia, I forget, I don't I'm not able to do all the activities what I used to do, but still I am entitled for living a meaningful life where I can contribute to something. So that is a role model kind of a activity what many of the senior citizens are encouraged to do now, whether it is an adversity like mental health or even many other physical conditions. Like you might have seen many celebrities coming out and talking about mental health now. So, so this kind of coping mechanism is something very good in terms of people not thinking it as a stigma and then adopting a positive kind of approach. But what I would want you to focus more is about people who have day-to-day kind of stresses and then have a subsyndromal kind of mental health issues, which forms a larger kind of proportion of people. If you look at, I think there is one study, longitudinal aging study of India, which actually looked at as to how many people were depressed. Almost 1/3 of them had a clinically significant depressive symptoms. They may not be diagnosed as depression by a doctor, but they had a clinically significant depressive symptoms, almost around 28 to 30%. If you look at people who have even less than that significant level of depression, many elderly kind of have some of the symptoms. So how do we kind of cope up with those symptoms? And what we see is that people should not resort to kind of excessive use of interventions before or for a minor level of problem. In a minor level of problem, I think a lot of non-pharmacological interventions have a very big role. Sometimes we also see other end of the spectrum where people, even with a very small problem, no, they think of a very complex solutions. They go to super specialists, they go to for medications. Okay, they look for all sorts of therapies. So I think what is very evident is self-help at the very minimal level, and then lifestyle modifications do help in people who have a minor level of health problems, mental health problems, and like things like yoga, things like say social activities and engagement. These things have and regular physical activity and having a cognitive engagement has actually found to be very effective for subsyndromal level of mental health problems. And that, I think there are many examples where people would either go for some kind of their volunteering services or spiritual kind of activities, various ways how one can cope up with their health problems. And there are many examples like that. I think we, even though we sit in a hospital, and in the last few years, we have actually got kind of a lot of community outreach initiatives. We interact with a lot of senior citizens in old age homes, senior citizens in the community, and we hear a lot of such positive stories. And I think that is something very, very encouraging sign now. With the power of technology now, I think initiatives like Vaya Vikas can instill such kind of movement, kind of skills in many people. And our own experience of Vayomanasa Sanjeevani, where so many senior citizens come across and then they come together to kind of have a positive kind of approach. And in fact, when we started this Vayomanasa Sanjeevani, we talked about illness initially. Then based on the preference of senior citizens, no, then we talked about more about how we can actually cope up and how we can look at various social issues. So I think this is something like a collective learning, this kind of a group environment, no, it's a collective learning that can happen.
That's true, sir. And being a part of India, where there's so much, there's such rich cultural, norms which have already been set for us, then I think, this we can definitely make use of all our cultural activities like singing and music and, our religious, our spiritual teachings, which will definitely go towards the self-help, because ultimately self-care is something that we all doctors want to promote in our in the society, so that no matter what they come across, they will be able to adjust to. The resilience of society is built by us, teaching people self-care, self-help. But supposing, sir, the senior citizens themselves actually need help, so how would you, what is it that a caregiver, somebody who looks after the senior citizen, how would they then be able to recognize and help that this is a senior citizen who probably needs to be, guided so that they can come back to, normalcy. So is there anything that, so how do caregivers, how do they recognize that the senior citizens with them need help?
I think this is a very important question. See, when we say self-help is important and self-care is more important, because the extent of problem, what we discussed in a subsyndromal level, when it exists, I think that is the most important strategy. But at the same time, it's when you look at the other end of the spectrum, where people who have serious mental health issues, what we see is that almost 90% of people who require treatment are not on treatment. And people have a very poor understanding of mental health issues. And not only about mental health issues, I think this is something like very prevalent in this population, even about various other health conditions, like whether it's some serious health conditions or common physical health conditions also. Because I think our society I think we have a lot of positives in terms of cultural strengths, but at the same time, we have a lot of misunderstandings and myths and misbeliefs, which is very prevalent in our society. And a lot of people believe such things, and then they avoid coming for care at a proper time, and then they suffer a lot. I think that is where it is important to recognize. And the most important part of mental health problem is when somebody develops a significant mental health issue. In many conditions, the person themselves would not have a complete understanding or awareness, because it's an integral part of the problem. For example, a dementia, a memory problem, when it happens, 80-90% of the patients will not think that they have a memory problem. They will think that their memory is all right. And even when it is very obvious that they are not able to remember, if a short-term memory is very poor. Okay. So the caregiver's role becomes very important in that sense. So as I told, this is a continuum. So the moment somebody has a memory problem, one should not think it is extreme. It is something like an illness. So at the same time, when it is consistent, when it is significant, severe, you should not think it is normal. So this is a judgment which has to make. And the any emotional problem or any cognitive problem, if it is persistent, if it is going on for weeks and months, definitely this requires a review by an expert, so that to decide whether this person has a problem which requires treatment or not. Again, the severity, even if it is for a shorter period of time, if somebody becomes very severely depressed and they are refusing to take food, they are suicidal, they are not able to discharge their normal activities, even if it is for 1 week, that requires attention immediately. So one is duration, second is intensity, the severity of the problem. And here, I think the most important factor one we need to understand is mental health problems are treatable, and we should not have stigma. I think stigma is one of the important barriers, which unlike physical health issues, I think the elderly themselves may be offended when we say that, okay, sometimes whether we have to go for a mental health consultation. These things are changing to some extent, but I think still even among the educated, there are many times people, when we go for outreach, they say, don't talk about mental health, but you tell us how to remain happy, how to solve our problems without revealing that we are actually taking any professional help. We don't want to discuss about topic of mental illness. So it is quite prevalent among elderly, and it is quite an important thing for us to understand. And I think there is a change is very much required, where we need to remove the stigma. So the early symptoms, say generally all mental health conditions will have varying kind of symptoms, but the most common ones are depression, anxiety, and dementia. I think these three are the one which you need to focus. In this depression, you will have what we say as a pervasive kind of a sad mood. A low mood can be there, or you can have, sometimes it may not be low mood. You may find the person to be very withdrawn and not interacting not involved in activities. They may have irritability at times. So any mood change, which is quite significant and which is sustained, it requires some attention. Then second is cognition. Cognition, when we say it's about thinking, how do they think? So when they think, if they think very negative, it's also people say that elderly, it is normal to think like that. Okay, so it is not something like an occasional kind of expression. Somebody saying that their body is not working properly, they are helpless, nobody is there to help them, and they're nothing is going to work for them. So they don't have any hope in continuing any treatment, or they are not taking care of themselves. Again, that is an indication of significant depression. So that requires the ideas of helplessness, hopelessness, and worthlessness. These are something core symptoms. True. And more importantly, loss of interest in pleasurable activities. Some of the kind of hobbies and things which routine activities, what you are doing, whether it is a morning walk, or you are enjoying an interaction with some neighbor, doing some maybe some spiritual activities, whatever you used to enjoy. If you are not enjoying that, if you feel very disinterested, again, that is a sign which needs to be which can be part of depression. Then feeling anxious about various normal activities to an extent that where you avoid things, you procrastinate. And this health anxiety is something very, very important, where somebody keeps repeatedly seeking help. A lot of somatic complaints, bodily complaints comes. So sleep disturbances and food, not having proper appetite and kind of losing weight. So many times what we see is that there are people who lose weight without any reasons, and they would go, all extensive investigations will be done. But it may be just a depression which may be missed for a very long time. So I think when it comes to such conditions, we need to kind of keep mental health also as one of the possible factors and then look at that.
So usually there is, because I have been dealing with senior citizens, I am a senior citizen. See, there is a fear of aging, just a fear. It's like, you know, you're going into the unknown. You don't know what's facing you. Now, in our chat, I've been reading the comments, and you know, this empty nest syndrome, you know, where your children are not with you, and they are abroad, but they're not with you. So if something was to happen, something as simple as I slip and I fall, then who do I call? What do I do? And very unfortunately, though you're doing so much community work, so are we trying to do it. The community awareness, you know, where one can help the other, you know, that has to actually be brought in, so that this fear that people have of being alone at home with no one to turn to, that is something that I think you all have been addressing now with your community work. We are trying to do it through our NGOs, but that's a fear that is very prevalent, sir, amongst all senior citizens.
I think there's some noise disturbances in the background. Please pardon me. I think there's something which is happening in the outside our department. Okay, so I think fear about aging is something which is very commonly seen, and this is something like which is very physiological. You can't change it. The longer you live, you will age continuously, and I think with aging, there are a lot of challenges that comes. To some extent, we can say that some of the fear is genuine. There is a concern, but when it becomes pathological, is you kind of brood about it so much that you don't kind of live happily in your present life, because future is uncertain, because uncertainty is definitely there to some extent. What you can prepare, what you can take care, I think that is something which we need to focus. And sometimes it becomes a very pathological kind of a fear. So where people become extremely cautious that they don't want to step out of the home. For example, somebody has a fall. Because of fall, they become so dependent, they don't want to walk and they don't want to step out. They may not have fall, but their quality of life will be very significantly poor. Even if they had actually gone out and had a fracture, they might have got better. But
quality.
Going out, they lose a lot of things. Okay, if you ask me whether by encouraging them to go out, whether the fall can be kind of completely foolproof manner, it can be prevented, no, because our environment is not very age friendly in many aspects. Okay, but I think there has to be some kind of a balanced risk taking has to be there. So you need to take appropriate support systems. For example, using a kind of a supportive prop, walking stick is fine, but not. It is not fine for you to actually stay indoor completely and avoid walking. So that the benefits of walking and benefits of interacting with people you will lose. And it becomes, the more you avoid, you actually develop this anxiety in much more severe manner. So I think aging is something which is bound to happen. The advancement of health conditions, health care facilities, your basic nutrition in your childhood, all those things this is something like predetermined. Large number of people who have kind of crossed 60 are going to live up to 75 at least. And there are many more people who are going to live up to 80s and 85s. And this is going to only increase. So what is required is preparedness. I think the preparedness is something which is very missing in our setting even now. There are some people who are prepared to do now, but in an organized manner, a pre-retirement kind of preparedness. How do you save yourself in terms of for your future, and those, and also the support services, both in terms of government services for people who cannot afford, as well as people who can afford a trustable kind of services. I think this is something still a long way we have to improve. But there are changes are happening. Changes are happening. I think in the last 5 years, I can see so many initiatives that is coming up. Okay, so I think fear is there, but fear, it should not become pathological fear. So if you start developing a fear and then prepare yourself very well, I think that is the best you can do.
Yes, totally agree. I mean,
start at 60.
That really, sir, should start off at the age of 40 and 45,
Yes.
you know, like you prepare for retirement from your jobs. Same way, I think one should prepare for the lovely and comfortable and graceful living as an elder.
But it is never late. But it's never late. Even if you are at 60, you can look at your resources. You can look at how you can say you probably everybody may not be having the complete resource where you can do everything. But I think an optimal kind of a plan you can actually have. And I think that will help you. You should think that, okay, you are living for another 15, 20 years. And then work out a plan even now with whatever available resource, what am I going to do?
So one thing that this COVID times, you know, this whole lockdown and something that it was unprecedented in a non-war-like situation, has taught us that very simple devices can be actually your friends. You know, you have your phones, you can get online, and I feel that one of the ways that perhaps towards happy aging is to connect. You know, if you connect with your family, you connect with your friends. It doesn't matter if they're in the next building, the next city, the next country. It doesn't matter. It's just about connection. And I'm sure that, sir, you must have found that out in your in when you you are taking this whole concept forward. That this is a very big part, connecting to keep happy. You know. With people. And then of course another thing is actually asking for help. And when does somebody actually ask for help, you know? And I think that is something that if you could just tell us, I mean, when does that time come when I say that I cannot do things by myself, I need help? And that doesn't mean that I'm going to be dependent on anyone. It's just that I mean, I can't, if you've ever been to Mumbai and you've seen the curbs of Mumbai, it's so difficult to get off the road onto the footpath. They're about 7 inches, 8 inches tall. And then if somebody's there, I'm bound to, ask for that helping hand to just get up onto a footpath. So this is what I must be ready to do. So what would you say?
I think technology is something which what you talked about is really has helped us to remain connected. And there are a lot of positives in using technology. And I think many organizations have done digital literacy program for senior citizens. And when we started this in October 2020, say our Vayomara Sanjeevani, we were kind of quite apprehensive about how senior citizens will accept this online kind of interactions. And I think many of them were able to kind of learn, and then were able to kind of see the benefits of it, and then they were able to sustain. I think this has kind of definitely given an advantage, particularly for people who have physical challenges, people who have logistic challenges, who are everybody may not have the wherewithals to kind of have supports kind of systems to travel in a busy city like Mumbai or Bangalore, or it becomes a very challenging thing. So despite not able to travel, you can remain connected using technology. You can use technology to remain engaged, play active games. We do something called a Sandhya Karanji. So every week on Saturday, senior citizens come together, and then they do puzzles, they do games. I think one of the first programs, somebody, a software engineer from US, did a magic show for senior citizen, waking up at 3 o'clock or 4 o'clock in the morning for their time. So, and I think it's a phenomenal kind of a tool which helped us a lot in kind of bringing together the people. And technology has also a kind of negative aspect where sometimes people remain only hooked up to the mobile and WhatsApp. We do have complaints from families where they say our senior citizens, sometimes they look at only WhatsApp and then they overuse, because any technology, I think whether it is for children or any other age group, we need to have a balance. So it should not be at the cost of in-person interaction when it is possible, within the home as well as outside the home. I think sometimes people get too much into this, so it becomes a pressure. So you need to optimally use these technologies. And COVID has taught us being connected with your local community is very, very important. And I think a lot of volunteering things, a lot of people who were able to kind of help each other. And if you look at assisted living communities, that is something which has kind of become a very big development, because people have realized that you can't kind of live in isolated kind of a place in a single home as a single person. You need to remain connected. So that is something like the support services are improving. There are many services are being launched nowadays to use technology, and I think a mix of technology and in-person interaction is very important. Everything cannot be done by technology, but technology will definitely be helpful in enabling. Use it very optimally, and we need a good amount of volunteering kind of services also. I think within the community, we need to build cohesiveness and build a group, what we call as a peer support, a senior citizen helping somebody else. Because we have seen a 60-year-old senior citizen going across the city during the lockdown, helping 3 or 4 80-year-old or 85-year-old persons. Because the children are living in US, they are not able to come.
Sure.
And all the healthcare, their routine video conference, the person will not be able to do video conference. So he will go every weekend and then he will do video conference with us for follow-up. So there are many situations where senior citizens can be very, very helpful. And I think the younger old can be actually can be a volunteer to help many other people. So that is something which we need to inculcate. I think the volunteering and service is something. I can give one example where there is one volunteer who comes to Nimans. I have seen him from the time I have been a student, and he's been coming even before me, one Mr. Ramasamy, and he's now I think 85 or 86. He comes in Bangalore traffic from a distance of around 15 kilometers.
Wow.
On his own expense, he comes, he goes to 3-4 hospitals. I think every day he has one hospital. Nimans has, he comes on Wednesdays, and he comes and helps any patient who is walking across. He will try to help them, guide them. He knows all doctors, and he will help, and genuine help where there is no other benefit is kind of expected. I think he is very happy. His family is happy, and he is not very rich. I think this is something, an example, what I would always say.
Wonderful.
Volunteering doesn't need money. Volunteering needs more of attitude.
Yes. In fact, volunteering in senior citizens also improves the health, sir. Because we did that in our hospital. We had 10 senior citizens going around volunteering, like you said, and it actually improved their health. So what about talents? What about discovering talents in senior citizens? Senior citizens discovering new talents, learning new, skills. And, what would you say about that?
I think in terms of factors which helps your brain function, and also mental well-being, I think anything learning new tasks or new talents is something very, very important. Because I think there was a time when people were thinking that once a brain is kind of developed, there is no change can happen. It can only degenerate. But there is now enough evidence to say that there is something called as a neuroplasticity. Because the more active you are, the more brain function you have. And it actually helps even regeneration to some extent, where somebody who develops a stroke, that particular portion of the brain will have lost function. But in terms of rehabilitation, when they are doing activities, if the person who is doing more active rehabilitation will improve faster. The same way, people who are active and people who are learning new languages, new skills, their brain degeneration is much kind of slowed. If you ask me whether it will prevent dementia completely, no. For example, you may develop at if you have a risk to develop at 65 years, it may postpone by few years. Okay, the evidence is there to some extent. It can be a very effective preventive factor. Okay, but it may not completely prevent, but it may delay things. So it is very important for us to learn such things. And I think it is one very good. I think when we say for healthy aging, when we say for cognitive healthy aging, somebody who's having a mild kind of problems, I think this is a prescription what we give, because no medicines help. I think learning new activities is something very, very helpful for remaining more healthy.
So what about exercise? Because you mentioned that in the beginning. So exercise is known to enhance happiness. How does that happen? I mean, what brings in that feel good, that good feel good in us because we're exercising?
Exercise has a lot of benefits. Whether it is about if you look at many conditions, whether it is health conditions like hypertension, diabetes, cardiovascular conditions, depression, it's a universal kind of thing where optimal exercise, aerobic exercise particularly, walking or brisk walking or running, say swimming, and any of the things which is aerobic exercise is much more helpful. Even other exercises like doing some weights and resistance exercise also help to some extent. Yoga again is not just exercise; it has its own additional benefits. And one of the mechanisms is it has a role in endorphins, and it secretes some things like there are people who are addicted to exercise, where it is something like they cannot stop. They I think that keeps their hormones, that happy hormones, what we say, endorphins, that get secreted more. And it is not just that. You are happy because your body is also happy. Your muscle flexibility and your
So we can't hear you.
Can't hear you.
cues. Hello.
Yes, sir. We can hear you now.
Now we can hear you.
Yeah.
It is just a network issue. So exercise also kind of improves your general health and well-being. Sleep gets better. So if you do optimal kind of exercise, your sleep gets better and your mood gets better. So for a simple kind of a hello.
Yes, sir. We can hear you, sir.
I think there is some fluctuations.
We can hear you.
Okay. Somebody was indicating that they're not able to hear. Okay. Hello.
So we can hear you, sir.
Okay. So I think Mr. Vishwanath, you can check connection, because other people are able to hear. You can check whether your system, whether there's a problem. Okay. So I think exercise has these kind of benefits where, and particularly sometimes you have a group exercise, something like yoga and group walking, that gives a social engagement also. So that has an added kind of a benefit. So and there is a lot of physiological kind of things where people who have exercise regularly, lot of health functions improve, right from sleep to digestion, sleep kind of physical fitness, where they don't fall, and their mental function, their cognitive function also improves. So all these things leads to kind of well-being. Okay, if you are able to kind of feel your body as doing well, and you are physically well and you are mentally well, then it brings in happiness.
So what about humor?
Yeah.
What about humor in a person's life, especially in a senior citizen's life? I mean, does that help in,
Definitely. Definitely. I think so. Looking at everything from a perspective of humor is something which is a healing power. A lot of laughter clubs you can find, and I think when people get together, I think that is something which each one making fun of each other, as long as it is healthy. I think they relive their college days. I think many times senior citizens the kind of groups what they form. If you observe them, I think they will be living their childhood. they will be living their college days. They will be seeing, because I think that humor actually gels, brings them together as a group, and it can actually make them forget about many of the other sufferings what they actually have. That's kind of a quality time what you get. I think that's very, very important. And in your normal life, I think humor doesn't need to be remaining with only with say friends and in some outside
Yeah,
circle.
in fact, they've been saying that humor is the best medicine. I
Yes.
mean, I remember a Reader's Digest, entire thing was.
It's an attitude. It is an attitude, like, so you even when you develop a challenge, no, sometimes you need to take it. Okay, this is something is there, but I have to. If your attitude, if it kind of carries that kind of a positive attitude, no, then it, I think you may be able to cope up much better than somebody who becomes very, very upset about any issues.
True, sir. And, there's a lot of questions have been asked about intergenerational bonding and how that works. And so is there something that, that senior citizens should be doing, about this intergenerational bonding? Something where, you're connecting with your children, but more so you're connecting with your grandchildren. Some of them probably have great grandchildren. So, how does this come into our happy and graceful aging?
I think in our culture, no, this is something very, very important, because I think we are still having a much larger value for our family relationships than I think everybody. I think even when the Western world, families are important. I don't think it's something like it's a completely individualistic society. Every part of the world, I think people have families, and then we can't generalize saying that only we are unique. But in our culture, I think this has been given much more importance. Where I think recently one of my thesis student had done on successful aging, and I think this theme had come across something very important, where they want them to be acknowledged, they want them to be kind of valued by the younger generation. I think we need to look at it two ways. One, we need to appreciate that the things are changing. The culture is not something which is very static. With the development, a lot of changes happens in the attitude of each generation. So what we had seen in our childhood, how we had actually related to our grandparents, you can't expect the same thing with the current generation kids. So I think this is something like we can't simply preach saying that, okay, younger people have to be kind of more accommodative of us, and how much the senior citizens also have to kind of adapt themselves to the current changing world. I think a lot of values what we have actually cherished and which we think is very sacrosanct, people of this generation may not think so. I think it is something like we may disagree, but I think it is something which will change, because this is something you can't prescribe. So how people are able to kind of live kind of together or bond together depends on this mutual kind of understanding and give and take. I think senior citizens have to go a step ahead. Actually, they actually have to be accommodative, and they have to be kind of looking at ways how they can actually build this kind of relationship. And this can be, sometimes it's not possible for a person who is living in US or UK to always be there in person. But I think you need to use technology, you need to visit, you should not have rigid attitudes. I think that will kind of help in this bonding, and a lot of importance is there. We need to sensitize younger children also, younger generation also. But I think a lot more needs to be done for senior citizens themselves. They need to have an attitude which will facilitate this bonding.
True, sir. One of the messages that have come up is that we need to listen more. I'm talking about senior citizens.
Yes.
We need to I think that is one trait that we need to enhance in ourselves. Learn to listen, because we are, let us declare ourselves as experienced and wiser. So if we listen, then we can actually impart better, advice than if we were to say, "No, this is what I think, this is what you do." I mean that's where the entire problem does occur, sir. Yes.
Very
But
much. I think very correctly said. I think
yes,
listening is very important.
yes. Listening is something that is an art that I think we all must learn. So, are there any tips that you can give before we open up the forum to our audience?
Volume வரதில்லை.
Yeah.
Voice வரதில்லை.
Are there any tips that you would like to give, our senior citizens? Are there any tips that
Microphone connect.
you'd like to give the caregivers who, there may be caregivers here. I mean, a 60-year-old person may be looking after their parents who are 80 and 80 plus, So are there any tips that you can give of this happy aging, and how do we go about it?
Yes, I think happy aging is something not only for super healthy individuals. Happy aging or positive. What we now more and more we are talking about healthy aging. Actually, this is something which can actually be. We are in the decade of healthy aging. Decade of healthy aging is from 2021 to 2030. It talks about more of functional ability, like how you are able to meaningfully do something at whatever level of problems you have. And that depends on the person as well as the environment. It is about the intrinsic capacity, what the person has, the physical and mental health capacity, and the environment. So everything is not in our control. What is in your control, we need to kind of be prepared for it. And the preparation starts, you don't start preparing only when you become sick. So aging is a continuous process. Now, I think the most important things are physical health, being kind of taking care of your body in terms of all the health aspects, whether it's a hypertension, diabetes, or whatever basic things, in a manner where it is something like sometimes extreme health anxiety, where people lose their life and then focused only on medications. It is not like that. You need to have an optimal kind of a balance where you need to enjoy your life, at the same time take what is necessary medications. If some doctor had given 20 medications, 30 medications, take second opinions. Okay, so polypharmacy is something like sometimes people give indiscriminately a huge number of medications. You always should actually try and check whether this is really important or not. Okay, so taking care of health requires self-care, and say you need to take things properly, whatever treatment, what is there, that needs to be done. The second aspect is mental health. In the mental health, as a psychiatrist, I would say that is a much more important part, and it is something like where people are neglecting. So it is not about say just living, it is about happy living. Mental health is an integral part of it. So how do you cherish each kind of whatever time, whatever years left? I think somebody had asked us to how do you develop this attitude. I think mindfulness is something like is a strategy. What people tell that is something like where you remain little detached and look things in a much more impassionate way, and try a different perspective. What will other person think? Okay, try a different perspective. And these kind of things can, your attitude, if you are able to kind of modify in a way where it can be a positive attitude, I think that will be very helpful. When it comes to health, I think the positive things like having a good sleep hygiene, good physical activity, proper diet, I think these are something which is very common thing for both general health as well as mental health, physical health and mental health. And cognitive activities, being productive, being cognitively active, whether it's reading newspapers, doing your puzzles, having some games, whether it is using devices or our traditional games. Okay, and even cards, any kind of things where there is a fun, there is some activity to brain, it's very helpful. Second, learning new skills, those are something which is very, very important. It may be cooking, it may be some hobby, it may be some other tailoring or anything which can be done. Then I think these positive things will definitely be very helpful. Social engagement is very important. You need to remain connected, whether within your family, relatives, or even the extended social connection, where you need to have your friends, you need to, I think spouse, as a couple, many times senior citizens are something where we see a lot of people, the couple are the one who lives in the household, and they have to support each other. And this is something like many times the relationship, no, I think still that kind of equal importance is not given. And the attitude happens, like somebody would have been a very busy executive. After retirement, they will think that the wife is not treating well. And so this kind of building a good relationship and living their life, it is not something they have to take care of grandchildren alone. They have to kind of do only something where they have to assist others. You have to live your life. I think you need to be able to plan your life, and you can help with the younger generation, but you need to take care of yourself, whether it's a financial safety, whether it is about your priorities, how to kind of give importance to your priorities. Don't think about what others say. Don't think about how people will evaluate you. I think these are attitudinal changes which are very, very important. When you have a distress, when you have a problem, I think seeking help is something very important.
Sure.
Seeking help from appropriate source. If you're not convinced, maybe one more opinion is fine. And be informed. I think health literacy, whether it is about balanced kind of health literacy, is also very important, where you don't get kind of somebody is kind of taking you for a ride. So you need to know what you are doing and be informed. Don't believe whatever people are saying. And then there are a lot of therapies, a lot of people are willing to kind of offer solutions which are unproven, which are sometimes very expensive and dangerous also. So you need to kind of, many reasons are vulnerable in that sense. Like when you have a health condition, no, something like a cancer, people will say that, okay, don't go for treatment. You go for something where you take some supplement, cancer will be cured. So I think this kind of myths and misbeliefs is something like you need to stay away from it and safeguard yourselves. I think that is something like optimal, making a will or whatever is the financial planning, what you need. I think these are something which is very important for you to kind of have a very safe and good quality of life during your aging time. Okay.
So, in fact, in the latest national mental health policy, one of the things that they've mentioned is advanced directives. You know, they are now actually telling people that plan your health, you know, what do you expect as treatment? You see?
The advanced directive, I think advanced directive is something, a concept which is very, very important, but it is not there. Say, for example, somebody who is a 90-year-old person may not want to kind of remain in an ICU where they don't want to be intubated, they don't want to be in a ventilator for 1 month, 2 months. They can actually have an advanced directive that I don't want to be resuscitated if I develop a cardiac arrest.
Okay.
So I think this is something very common in Western world, and in our practice, it is not done. So what happens is when you have not expressed your choice, the family members may not be able to take decisions sometimes, and the health situation, wherever the health services is not something like where these kind of decisions are taken in a very, very optimal manner. So your preference, for example, I recently had one of the kind of very senior cardiologists who had passed away, and he had expressed his wish where he has to be cremated to his friends, but he has not actually written down, or he has not actually made it very obvious. So those kind of things, the family may not actually respect that if you are not actually communicated things to properly. If you want some things to be done, you need to kind of prepare yourself for those kind of things. So financial planning, again, the advanced directive is about health specifically, where which treatment has to be given in what context. In with respect to mental health, this has a very, very significant issue in terms of hospitalization and refusing some of the treatments. But with respect to aging, it can be a much more a generic principle where you can express your wish. I think most often it is about some of the treatments, invasive treatments, they don't want. So that kind of a decision people can take. I think primarily about resuscitation. Like I don't want to remain in ICU. I think that is something I wish a lot of people have, but they would not actually voice out and express. And these things are I don't think it is very, very strictly implemented as of now. And the mental health policy, what you talked about, is primarily talking about only mental health related treatment decisions. It doesn't talk about other aspects. But as a principle, I think this is something very, very important.
Right. Sir, should we take some, let our audience share some experiences that they have?
Definitely. I think,
Yeah,
I
think somebody was asking about COVID and, so, yeah. So, I really can't see everyone, but please, I mean,
there are some chat questions. I think if you can actually say which we have not covered, we can cover that also.
Yes.
Yes, sure. So, doctor, there was one question about is dementia inevitable in the elderly?
Yeah. See, there are people who are centenarians who are living up to 125 or 114 or 115. I think in Japan, they don't have dementia. Okay, it is not something inevitable. There are people, centenarians. There are centenarian studies where centenarians who are very healthy and super healthy kind of centenarians. So the longer you live, the risk becomes more. Okay, so in 80s, for example, above 85 years, almost 30% of them or 40% of them will have a risk of dementia. So in above 65 years, it is about 5%. Okay, so with every 5 years increase, the risk doubles. Okay, but it is not something which is inevitable, and there are lots of modifiable factors which can prevent. I was telling about, I think there is a Lancet commission which told about 10 modifiable risk factors. We repeatedly emphasize that. I think that starts from literacy, childhood literacy. I think people who are educated, they get a protection, and then nutrition, then their diabetes, hypertension, depression. These are all some of the important modifiable risk factors, and social engagement, physical activity. All these things can reduce almost 30% risk. Okay, so it is something which can be modifiable.
Sure. The other question that was there from the audience was, has COVID added more complexity to aging?
It is. I think not only in terms of health, because a lot of uncertainty is there. We don't know what is the long-term effect of this. So how, because we know it is affecting multiple systems, whether it is about vascular system, like the blood supply is getting affected, the lungs are getting affected, brain is getting affected. A lot of research are being done, but to put it simply, I think nobody can say the long-term effects because we are not studied.
Yeah.
So we have to look at the long-term effects. I think COVID is not just about physical health. COVID has kind of taught us lessons about a lot of other social issues.
Yes. So I ran a dedicated COVID hospital in Mumbai, and we had about 90 COVID patients admitted with us. And this was the first wave, the Alpha variant. And we had a lot of senior citizens. And there was a strict rule that there were no visitors allowed. And so for the first time, the senior citizens had to take their own decisions. That when their oxygen demand went up and we needed to transfer the patient from the ward to the ICU, this was usually done by, all your family getting together, thinking about it. Here, the senior citizen had to take his own decision. Yes, okay, I'm going to the ICU. I mean, it was very tough. But I must say something in defense of senior citizens. Sir, they adapted so well with the uncertain times, with the uncertain treatment. I mean, I have seen this. And we, in the hospital, we went out of our way to try and connect them with their relatives on their mobile, on video chatting. And, we did that because we knew that this was an unprecedented event where a senior citizen was left on his own. So
I think we have a lot of positive lessons also are there where
yes.
How you have to build your own safeguards, how you have to kind of be strong to take decisions, and how you have to develop your own support systems. I think that is something, all those lessons are important. And I don't know, this kind of pandemics are not something which we can anticipate. But I think whatever lessons we can learn, we have to learn. And health systems have been challenged to the core. I think somehow we have managed it reasonably successfully. I think despite all the limitations what we have, I think in terms of vaccination, in terms of various kind of, we have survived, and we have kind of done much better. And many senior citizens have successfully gone through these things, and then they have come out more resilient manner. Some might have succumbed, but I think this is something, a lesson for all of us. And it has definitely complicated, it has made things complex. So healthcare systems, and we thought we have conquered the infectious diseases. We have gone to the basics now.
Yes. It definitely shook up the healthcare sector, but I think we did a very good job. So I think, we did a very good
I think
job.
we're much better in terms of how we have kind of bounced back.
True. Resilience.
Thank you so much, Doctor. We have two, people who have raised their hands. Yes, Miss Kokila, you could go ahead with your question.
Okay, you said something about telling the people that you don't want to go into ICU, you don't want to go under the tent and all those things. How do you do it? What, you write a letter and give, or is it to your relatives you give, or you give generally addressed to the doctors? How do you do it?
I think as of now, there is no legal way where there is a declaration is there in our system. For mental health, we have brought in an advanced directive system, but for general health, to the best of my knowledge, there is no such things is coming up. Maybe the Senior Citizen Act, which is coming up, has a mention of it, and I'm not sure whether it is the final thing has not been passed. But I think it doesn't require any other complicated procedure. You need to kind of make it available, and you need to inform the key people. You need to express your opinion. I think something like, say, when we are aged, we need to anticipate health situations where this kind of problems can happen. And you need to express your preference, but it is not guaranteed that 100% your wish will be followed.
Yeah.
But it may be taken into consideration, and the doctors and the family members who are your guardians, or whoever is your nominated representative. Okay, naturally children are there. If I think this becomes very important when children are not there also. I think many senior citizens live alone, and the first responder, whoever it is, you need to kind of have some person who knows about what is your preference. Okay.
Writing?
Yes, in writing it is good. In writing it is better. Yeah. Okay. So, and
Doctor,
Doctor,
I would like to comment on this. Doctor, if you can hear me, Dr. Shivkumar, I'll comment on this. There's something what is called the will, which we make for the future, that is after we pass away. But there's something called the living will. The living will states what we would like it to happen, what we would like our caregivers and our relatives to, how they would need to support us when we are at different stages in life, in our end of our life. So that can be made out, and that can even be registered for that matter. So that means that will hold good over every other decision which any other caregiver or a doctor or anybody else can take.
But correct. Sir, may I just say something?
No, Doctor, 1 minute. I have got one question.
Okay. Sorry.
Yeah, I have one question for Dr. Shivkumar. Yeah. Doctor, it's like this. Now, you mentioned about early stage recognition of dementia or getting into depression. How is it, see, as a caregiver, like say I'm a caregiver for my wife, it's very difficult for me to understand at what point of time that she needs this type of help. Is it possible, you're in NIMHANS, but suppose the patient is not able to come to NIMHANS, but is it possible somebody can come and visit and say that, yes, this is how they are, give them, give the family, I mean, myself, my son and others, what is it that is required to be done, which is very difficult for us to do it otherwise. Main point is we are not able to recognize if it is really a mental problem. It may not be, I don't know. But taking somebody to NIMHANS becomes an issue. Like you said, it's a cultural issue. Is it, if somebody can come home as a doctor and then do it, it makes it much easier.
Yeah, I think.
Is there any facility like that?
Yeah, there are facilities where people are actually offering services for home-based kind of consultations. So there are organizations which
Uh-huh.
are arranging healthcare visits, and then sometimes it is a kind of health worker assisted kind of consultations. There are health workers who visits and then they connect with doctors using tele or online consultations are there. And say, unfortunately, in our system, home-based kind of visits have not been a very prominent kind of facility. And if you look at UK, many of the evaluations for senior citizens will happen at home. We don't have that kind of resource. We would want to do it, but we don't have that kind of resource. We do it as a very exception. But in general, to kind of provide that kind of service, none of our health systems have sufficient kind of resources. So some organizations in places, for example, in Bangalore, there are organizations who are giving that. I think many of them are private kind of facilities. And the most important part in early recognition is about having knowledge, having literacy about what is the kind of health problem. And if you, then you may not be able to diagnose. For example, a caregiver may not be able to kind of come to a conclusion whether this is normal or this is an early cognitive impairment. Okay. So because it's so complex, even for doctors, it is a clinical judgment. Based on all the evaluations, we need to come to a judgment. So the differentiating in a borderline kind of a situation is something which is much more complex. So what you need to do is when to seek help and how to seek help. So when it comes to when to seek help, anything which is persistent, when it is a problem, it is sustaining for few days and weeks, it is something happening in a consistent manner, or if its severity is more, then you need to kind of seek a consultation. That is more important. And seeking consultation doesn't mean that you have to come to hospital. Teleservices are very much available. For an initial level of consultation, teleservices are fine. If they say that, okay, this is something which requires in-person consultation, then you can go. If you're not willing to come to NIMHANS, there are many private places are available. Okay. So in a city like Bangalore, I think a lot of help is possible.
What about Chennai?
Doctor, does NIMHANS have video consultation?
We do it. I think the video consultations are available. Okay. So whatever is possible, we are doing, because we don't have, say, Government of India encourages this e-Sanjeevani, but everything cannot be done by tele. So initial kind of some kind of a screening can be done. We do provide services based on request. As of now, I would not say that this is something like as a well-established service where we are able to give this to everybody. We are trying to improve it. We are trying to improve it. Say we have our Vayomanasa Sanjeevani platform, where in our geriatric services, if there is a request, we try to facilitate video consultations initially. Some kind of evaluation can happen. Subsequently, many patients will require an in-person visit.
Yes, I know. That's the reason why I asked. And the patient, like
everything
like you
be
mentioned,
possible only
patient may not be interested in coming to the hospital.
Yeah. So whatever possible advice we can give, we do it by tele also. But depending on the request, depending on the issue, what is there, then that we can decide, because we can't generalize that everything will be possible by tele.
So one of the
Sure,
things
doctor.
you brought
Agreed
up,
about it. Thank you.
one of the things
Thank you
you
very much,
brought
doctor.
up, one of the
Thank
things Dr. Sivakumari had brought up was the community involvement and the community health delivery, something from the community. So what has now a very good step that the government is taking is they're bringing out nurse practitioners. And these because there are not enough doctors to go around, but these nurse practitioners, we now should make use of them, as all other countries have done, for them to go out into the community and reach out to all the people who need who need help. I think that's something.
Definitely. I think say in our unit now we have started a 1-year fellowship program for geriatric mental health nursing.
Yes.
So post MSc psychiatry nursing, we are training them, and we are trying to train them in this kind of aspects.
Yes.
Okay. So this is one of the resources where we are having, where we may be able to do some home visits as part of the training. But I think there is a need for much more multidisciplinary, or particularly nursing team, where they can go and connect with the doctor. They can do the initial evaluation. This is something which, as a development, it has to happen.
Yes.
Thank you so much, Doctor. Any other questions that I think we can have one or two questions that we can get on. Doctor, there's one question about how to rectify physical weakness in an aged person. How to rectify physical weakness in an aged person?
The physical weakness, what they were mentioning, maybe frailty possible. And I think that is something like dependent on, one is about nutrition, second is about say exercise. Say, because a lot of times, the frailty becomes more when somebody is not using their body properly. So you need to have what we call as a strengthening exercise also. And this, if there are weaknesses where it can happen because of pathology, something like a stroke, which can have weakness. There, it is about rehabilitation, where physiotherapy and which is something which is very important. And preventing stroke, you need to take kind of drugs which will whether it's antihypertensives or other medications which are improving your blood supply. Those things have to be done. So when you say physical weakness, it is about physical weakness can be due to multiple other health conditions also. For example, diabetes. Somebody who is having diabetes may also have physical weakness. So that requires. So you need to have, if you just have physical weakness, you need to see what is the factor which is underlying that. It may be a depression which can contribute to fatigue and weakness. It may be a diabetes. It may be anemia. So you need to have a general evaluation. And other than things which are detected, there has to be good diet, physical activity, and overall your well-being. If you have to kind of take care, then physical health also, physical weakness also will improve.
Thank
So
you.
are we incorporating the 10-second, standing on one leg? I mean,
Yes.
are we incorporating that in the geriatric evaluation? Because you are running a geriatric center. So are we incorporating that?
These are geriatric, in terms of comprehensive geriatric assessment. No, these things definitely
Yes.
As a role, we do kind of look at these aspects.
Right. Is there any other question? I think Mr. Janardhan, you have.
Yes, I am fully satisfied with the answer, sir. But I have no problem, no BP or no sugar. Everything is all right, but I am feeling somewhat weakness.
Yeah, I think, see, one thing is that, say, with aging, there is definite change in your body also. I think that is something like many times people will say that I have become weak, I have become lean. Okay, so some changing physiological changes are happening in the aging also. A lot of people may comment on that. So sometimes I think if you start reacting in a, you may become anxious. Then you start focusing more on those things. Your weakness will become, it will appear more. So psychological aspects is definitely something which needs to be considered. So if you have done a basic checkup, things are all right, there's nothing else is found, you just have to monitor periodically. Don't every day look at whether you are feeling weak or not. One of the other factors also, something which is very hidden, is about sleep apnea. So I think that is something like people who feel who don't feel refreshing kind of sleep, and then they have daytime sleepiness and feel more fatigue, and they're not able to concentrate properly. I think that is something which can be detected by a sleep study. So this is again, we find in elderly people, it is quite often missed, because it is not something very typical. They need not be very obese to have this kind of things. Snoring is considered as a normal thing. So if your sleep is kind of disturbed, and if your daytime sleepiness is more, you feel more fatigue, this is one very important treatable health condition you can actually check. Whether you are having sleep apnea. So that is something which can, I'm not saying with respect to your condition, I'm talking more about a general kind of thing where there can be multiple reasons. Because when it comes to an individual, it is always a doctor talking to individually and then looking at all the aspects. Then only one can comment.
So what about sarcopenia and osteoporosis? I mean, these are two things that we generally dread, because one of falls in elderly, and sarcopenia, because we've seen that it's very difficult to wean them off ventilators in the ICU.
Correct. I think these are conditions associated with frailty, and osteoporosis is again very common. And again, good exposure to sunlight and vitamin D supplementation you can take, because vitamin D, you check, everybody is low vitamin D. Hardly we see people who have normal vitamin D level despite our sunlight. We don't know. So, but I think again, what you can do is good physical activity when you are healthy to kind of ameliorate these things to some extent. You may not be able to completely prevent everything, but you can improve your health condition in these aspects. There are many conditions which are common in aging, which is because all systems age, and it doesn't mean aging person should have illnesses, every illness, but they are vulnerable. They are vulnerable for these illnesses. So when it comes to early symptoms, you need to kind of check appropriately and then take proper treatment.
I think bearing in mind, Dr. Rekha, okay, bearing in mind the time, I think we have one last question, Doctor. It says, I am alone at home all day as children and grandchildren go to work. What do I do for company? Is there any suggestion that you could give us?
I think companionship is something, addressing loneliness is something which has been kind of talked about now. And if you look at our own Vayavamana Sanjeevani initiative, we have actually we are actually pilot testing some of an option of having a tele-psychosocial support, where one of the volunteers is getting connected to the senior citizen to address the loneliness kind of issues. So we are trying out in some old age homes, and actually there are some preliminary discussion we are having with Vaya Vikas also to kind of take this up as one of the ways how we can connect senior citizens to volunteers. So this is something which has been done globally in many places. And there are organizations who are talking about promoting companionship by having somebody who is kind of, at least they have verified them and then they are trained to some extent. They can come and help you with some activities. So there are some initiative startups which have come up like that. But more and more, I think what is important is your own community you need to explore. You need to kind of look at whether the community where you are living, is it giving you enough opportunities to interact and then to connect? If not, you can look at, for example, somebody would have lived in individual house all alone, but maybe their health condition may not allow you to kind of go and explore and connect with people. But if you think that your health condition is limiting this too much, you might have to find a solution which is the appropriate environment where I can move in to have a good kind of connected kind of life. I think this is something like where you should be able to kind of face these kind of situations and change yourself and look at solutions. And it is possible now with so many daycare and active aging centers coming up, online forums coming up, and assisted living communities coming up. At least people who are affordable, they have some options. But I think I'm more concerned about people who are in rural, people who are not having anything. I think that is where I think loneliness is something which is much more a problem, where we need to actually bring in some more solutions from at a government level. So as a society, we need to kind of look at as to how we can maybe in Anganwadis for senior citizen, something like which or how do there are some experiments where children daycare centers or Anganwadis and old age homes are placed in the same place.
Yeah.
So something like that are being experimented in some states.
Yeah.
I heard in Tamil Nadu there and Kerala there are some models they're working out. So maybe I think we have to innovate this kind of things and our own cultural kind of culturally appropriate solutions we need to bring up.
Joyce, I think that
Thank
should do it.
Thank you.